Thanks everyone for joining us today for a webinar where we're going to do a brief overview of the history of psychiatric treatment in Michigan and beyond. We'll be talking a bit about mental health treatment beginning really around the 1800s, where we look at what was happening in what was called state asylums at the time. And then we will move forward from there. We'll be talking a little bit about eugenics, because we can't really talk about mental health treatment without talking about eugenics and how that affected psychiatry. We'll move through and talk about some of the darker days of psychiatric treatment, some of the things that were done, as people, as a medical profession, tried to figure out how to help people with more serious mental health conditions, and talk about some current day public policy issues. So I really want to thank you for joining us. For those of you who don't know me, my name is Marianne Huff. I am the president and CEO of the Mental Health Association in Michigan. I am a licensed clinical social worker, and I've worked in and around mental health for 30 years. This is actually one of my favorite topics to talk about. By way of history, like most people, I entered into the mental health profession because of a family history with many members of my family having more significant forms of mental health conditions, particularly my paternal grandmother, who was actually at the Battle Creek Sanitarium and also at the former Huron Valley State Hospital in Ypsilanti that no longer exists. And my uncle, her son, who had schizophrenia, who was in Clinton Valley Center, or what was old Pontiac State Hospital, and other family members and friends. So I want to welcome you today. We're going to have a PowerPoint, and we're also going to have some clips. So without further ado, we will get started, and welcome. And as Kristen said, please put any questions you have in the chat. Well, thank you. Welcome to a history of psychiatric treatment in Michigan and beyond. I wanted to include these quotes. Well, actually, one is a quote from Kurt Vonnegut Jr., who had schizophrenia. But I also wanted to include, this is actual verbiage to the right, from an ad that appeared in Mental Hospitals, a magazine in 1962. We're going to talk about the development of Thorazine, but this was an ad that said, and you can read it, but I want to read part of it. Warning, mental patients are notorious drug evaders. Many mental patients cheek or hide their tablets and then dispose of them. Unless this practice is stopped, they deprive themselves of opportunities for improvement or remission, deceive their doctors into thinking their drugs have failed, and impose a needless drain on their hospital's finances. Believe it or not, that is an actual ad. An individual that I really respect is an investigative journalist named Robert Whitaker, who has written a lot about psychiatry and some of the darker aspects of psychiatry. And you can read this for yourself, but this quote that he has from Dr. Howard Rusk is sort of like the foundation, the fact that psychiatric or mental health conditions are just as real as physical disease and should be treated as such. And of course, we know that's not how it's been. And unfortunately, we still have a long way to go in terms of accomplishing that. But that's really the foundation of this presentation. So as I said earlier, we're going to talk about a brief history of the asylum and how we propose to treat mental illness in the 1900s, a brief history of eugenics in the United States, how it impacted psychiatric treatment, treatments, the good, the bad, and the ugly, and we're going to do a little bit on stigma and its impact on mental health public policy, although I would argue that stigma has really been what has been the main informer or informant regarding mental health public policy, whether it be at the national or the state level. that individuals with mental health conditions are not really viewed in a favorable way. And that has really informed the way that society, whether it be, again, in Michigan or in the United States, has chosen to respond to mental health conditions. So I wanted to start with a picture of Clifford Whittingham Beers, who wrote the book, A Mind That Found Itself, because one of the reasons, the reason why the Mental Health Association in Michigan exists is because of this gentleman. He started the National Mental Health Association. Now it's called Mental Health America. But when Beers wrote A Mind That Found Itself, he had spent time in both public and private asylums. He had a family history of epilepsy, and two of his siblings actually committed suicide. And he was a stockbroker on Wall Street, and he had some mental breakdowns. And he was so appalled by the conditions in both the public and the private asylums. That's what prompted him to write the book, A Mind That Found Itself. One of the things that came from that was not only the creation of the Mental Health Association at the national level, but also he helped found the Committee for Mental Hygiene at the national level. One of the things I'd like you to take away from in this presentation is the way that books that were authored by individuals who experienced mental health conditions or their families, and how bringing the conditions or public policy issues to the attention of the public and legislators did help create positive change for mental health treatment. So I wanted to make sure that I highlighted Clifford Beers. Here's a quote from Clifford Beers, A Mind That Found Itself. But I think what's interesting is he says, they thought I was stubborn. And in the strict sense of the word, there is no such thing as a stubborn, insane person. When one possessed of the power of recognizing his own errors continues to hold an unreasonable belief, that is stubbornness. But for a man bereft of reason to adhere to an idea which to him seems absolutely correct, like a delusion, and true because he has been deprived of the means of detecting his error, that is not stubbornness. I think that is very well said. So here is a brief look at treatment philosophies in America. So during the colonial period, we didn't have state hospitals until the 1800s. Most people who had mental health conditions, or for that matter, developmental or intellectual disabilities, were cared for by members of their own family, or they were placed in homes that were subsidized by the local community. Later, and this was probably around the 1700s, early 1800s, people with psychiatric disabilities were placed in what we would call almshouses or poorhouses, and they were considered to be wards of the local community. We struggled, of course, to know how to help these individuals. So there were different types of treatments, in air quotes. I think one that we all, if we took a psychology class, that we learned about was the ancients used to bore a hole in the head of the individual to let the spirits out. That was called trephining. So after, trying to figure out how do we help these folks, we would have these hospitals and they would be chained to walls. In colonial days, they could be put in chairs and spun around. It was Philippe Pinel who said, we need to treat them well. Moral treatment was basically, let's be kind and compassionate and provide personal care in the hospital. And it was in the United States that Dorothea Dix began the movement toward the development of state psychiatric hospitals beginning in the 1940s in Massachusetts. And we'll talk about that in greater detail in a moment. One of the things that, of course, happened was as, people were moving from the local community, there was a consideration was given to, is it the state's responsibility or the local community's responsibility to provide care for these individuals? And so we started moving from local care to institutions because at the time, because there was nowhere for them to go, of course, we would have individuals that were literally roaming the countryside. Dorothea Dix was the one who worked with a gentleman we're going to learn about momentarily named Thomas Story Kirkbride on creating these large, sprawling asylums. So as you can see, we developed more than 300 state mental hospitals between 1845 and 1945. Hospitals were supposed to provide more humane treatment. That was the goal. So in Michigan, and Governor Ransom initiated the creation of the Asylum for the Insane. So in 1848, the legislature authorized funding for the asylum. That asylum, which was the first in our state, is now called Kalamazoo Psychiatric Hospital, and it is still in operation. At least parts of it are still in operation. And it was built in accordance with the Kirkbride plan. So Dr. Thomas Story Kirkbride was a major and influential proponent of what we call moral treatment. And the asylum was supposed to be a place where people could go and they could be sort of secluded from life so that they could heal, kind of like stress reduction. And they were supposed to be able to get medical therapy. Here's a picture of Kalamazoo State Psychiatric Hospital. Now, one of the things that I want to mention is that these hospitals were built largely with a lot of Victorian architecture. And they usually were built with like hundreds of acres of land. They were not small. So there was the main administration building in the center of the complex. And then radiating outward were cottages or different buildings that housed the patients who had varying degrees of illness. Those who were not expected to recover quickly, they were in cottages or buildings that were closer to the administration building. The other thing to know about these hospitals is they were really like little cities unto themselves, wherein the staff lived on site, stayed with the patients. The patients were occupied with things like dairy farming because these facilities often had their own dairy farms. They had their own machine shops, bakeries. They grew their own food. So the patients were able to participate in, growing and harvesting the food. And so it was an all-inclusive environment. Here's a picture of the Eastern Asylum for the Insane, which was formerly Clinton Valley Center, which no longer exists. Another picture of Clinton Valley Center, old Pontiac State Hospital. And this is the old Traverse City State Hospital, November 1885. It no longer exists. Well, parts of it do. And you can take a tour of the parts that remain if you go to Traverse City. So in a minute, we're going to watch a film clip. There was a wonderful special called The Mysteries of Mental Illness. And the clip I'm going to show you talks about what happened as we progressed through the late 1800s and how conditions at the hospitals actually went from good to pretty bad. What they go on to talk about is the conditions deteriorated as we moved into the 19th century. And as they were saying, unfortunately, the buildings became so crowded that you literally had patients on top of each other, sleeping like head to head, foot to foot, side by side, patients having to crawl over other patients to use the restroom. The conditions became deplorable. So again, Clifford Beers writes his book, State Hospitals Are Crowded. And, one of the things too is one of the reasons for the overcrowding was the fact that we didn't have just people who had what you would consider a traditional mental health condition in the state hospitals. If you were to look at records, like at the turn of the 20th century, for example, what you would see is individuals who ended up in state hospitals because of syphilis. Years ago, when I worked in Ohio, I was part of what was called the Cemetery Reclamation Project for the old state hospital, the Toledo State Hospital, which had been torn down. And when I was working on that project, basically the land that had belonged to the state hospital was purchased by the University of Toledo. And when people would die in poorhouses or almshouses or state hospitals, they were often buried, sometimes in mass graves, or if they were buried and they were indigent, what they did in Toledo was they were given a number. They didn't even have a name, and they were literally buried in a pine box. And the concern was that when the University of Toledo bought the land, there was clearly a cemetery there, but they couldn't find it. So they found the cemetery. And what we did was people volunteered to use long sticks to locate the bodies and to protect the cemetery so that it would not be bulldozed. But what I remember vividly when we were looking at some of the old records were reasons why people were in the state hospitals. And I remember that you would see a diagnosis they would call syphilis lose, because syphilis being a bacterial infection, if a mother was pregnant and had syphilis, it would be transferred usually almost 99% of the time to the baby. Syphilis causes psychosis because it attacks the neurological system. So you would see people with syphilis, you would see people with epilepsy, you would see people with pellagra, which is a vitamin B deficiency, which untreated can cause death. You would also see sometimes people who had communicable diseases like tuberculosis would be placed in these state psychiatric hospitals. They weren't always sequestered the way that they should have been. So a lot of times, communicable physical health conditions would cause mental health conditions, and they would be transmitted to individuals. People were in there for terms, some clinical terms, non-clinical terms for lunacy, moron. I remember seeing a record of a set of twins that were born to a mother with syphilis. These twins spent their entire lives in the psychiatric hospital. The other thing to mention, I think most people know this, but for many, many years, up until the 70s, someone could take their loved one to the superintendent of the state hospital and say, my wife, my husband, usually it was women who were put into state hospitals. My wife is acting strange. She's not doing what a wife should do. And so I want her to be hospitalized for inpatient. And unfortunately, because we didn't have any laws governing this process, someone could be put into a hospital and never come out. And that's why we hear about a lot of the old state hospitals had what we would call the back wards. And those were people that were literally forgotten. And one of the things that I wanted to show you through the PBS video that they talk about is the fact that none of this was regulated. So you have people going into state psychiatric hospitals with all kinds of conditions. They die there, and there's really no record. I remember on that cemetery reclamation project, we were trying to match up the numbers that we found with the bodies that were buried. It was a very difficult process. This is where the term snake pit comes from. And if you are interested in this, Robert Whitaker, he wrote Mad in America, does a great job of capturing this. By the time 1955 arrived, there were over 500,000 individuals across this country who were in state psychiatric hospitals. In 1948, a film called The Snake Pit came out, and it was based very much on an autobiography by a woman named Mary Jane Ward, who had written a novel of the same title, wherein she talks about what her experiences were like in a state psychiatric hospital. And I'd show you a film clip, but my worry is that you won't be able to see it. So I'm not going to do that, but you can actually get the entire film on YouTube. I highly recommend it because it does a phenomenal job of capturing what the conditions were like in state psychiatric hospitals. There was, it used to be said that the ancients would heal people of mental illness by throwing them into snake pits. In this film, the story is about a woman named Virginia, a young woman who gets married, who starts to become what we would call delusional, and her husband ends up having her placed at the state hospital, and she receives really psychodynamic treatment from Dr. Kick, the psychiatrist. But what they do show in the film, which is disturbing, is the use of electroconvulsive treatment, ECT, back then, back in the 30s and the 40s when it was developed. A lot of times it was used mainly to control people, not so much to provide treatment. And what it would do is there was no anesthesia for it at the time. And so trying to get patients, if you will, to subject themselves to that, obviously, who wants to go through that? It induces a seizure for reasons we don't understand. Shocking the brain actually seems to help the brain sort of reset itself in some cases, and we'll talk about that. I mean, ECT is not entirely bad. We'll get into that in more detail later. I forgot to mention about the snake pit was the book and then the movie caused such a stir about the conditions in psychiatric hospitals that it was responsible for the creation of the National Institute for Mental Health at the national level. So again, similar to Clifford Beer's, Mary Jane Ward's book caused people to really take another look at how are we providing treatment and care to individuals with mental illness. So if any of you have heard of the eugenics movement, a lot of people believe that eugenics, which basically means well-born, or I would say it means good genes, began in Germany. It did not. It actually began in the United States. The purpose of eugenics was to improve the quality of the human race by discouraging those who had weaker traits or who had disabilities from procreating. They wanted to have a clean gene pool. And unfortunately, psychology contributed to this because back in the day, back in the late 1800s, early 1900s, when we were developing IQ testing, the IQ testing was oftentimes used on soldiers returning from World War I, but it also became used as a way of determining who should be having children and who should not be having children. One of the worst things that happened with eugenics was that we started really looking at, who should be allowed to reproduce and what qualities should you have in order to be able to reproduce. So as you can see here, you have American eugenicists believe that behaviors like alcoholism, poverty, social dependency, if a person was considered to be delinquent in some way, shape, or form, these were all caused by genetic defects. In other words, everything was caused by bad genes. Then they became interested in what they would call the feeble-minded. And so as you can see, in 1896, it was Connecticut that made it illegal for a person with epilepsy or someone who was feeble-minded to marry. And then, of course, the American Breeders Association was created in 1903 to study eugenics. And one of the things that was pretty disturbing was to find out that W.K. Kellogg, of course, Kellogg's cereal, Also, the person who founded the Battle Creek Sanitarium, if you've ever seen the movie The Road to Wellville, he was actually a major proponent of eugenics. Then we begin with the forced sterilization of people with mental illness. And of course, this also applied to individuals with intellectual and developmental disabilities. So we had a law in California that started the whole thing. And as you can see, for around 70 years, 1909 to 1979, there were 20,000 sterilizations that occurred in California. And that's only in the state of California. And then, of course, many sterilizations were also forced on and performed on minorities. And as it says, 33 states would eventually allow involuntary sterilization on whoever lawmakers deemed unworthy to procreate. If you've never seen this film, it's called The Black Stork, or Are You Fit to Marry? It's a silent film. It came out in the late, actually, that's incorrect. It came out in 1917, not 1927. You can find it on YouTube. It's a silent film. And if you can get past the fact that they have the sort of like the projection reel and the numbers on the reel. But basically, this film was one of the most popular films between the 20s, 30s, and the 40s. And it really promotes the idea that babies with disabilities should not be given life-saving treatments. They should actually be allowed to die. And so there was a case of a Dr. Harry Hazelden, a Chicago surgeon, who convinced the parents of a newborn to let the child die instead of having surgery that would have saved its life. And in the film, The Black Stork, or Are You Fit to Marry? Hazelden plays himself. And so, as you can see, it's a doctor who attends the birth of a child born with congenital syphilis. And as he's trying to, the whole film is about how he's trying to tell this mother why she should allow this child to die. Because, of course, if the child lives, he's going to become a social deviant and give birth to all kinds of social deviants who commit crimes and be feeble-minded. And so, as you can imagine, I don't want to give the ending away, but as you can imagine, the film is she decides to allow the baby to die. It's a very interesting film. It's not one that is easy to watch necessarily, but if you're interested in this, I highly recommend it. It was finally banned, thankfully. So let's talk a little bit about treatments now. I like this quote. This is from the Joint Commission on Mental Illness and Mental Health. You can read it for yourself, but I want to read the first sentence. This is a field where fads and fancies flourish. Hardly a year passes without some new claim, for example, that the cause or cure of schizophrenia has been found. So this is more of the ugly side of psychiatry. So the photo to my left showing the inpatient psych hospital is actually from Russia. The photo that you see, the other photo where it says psychiatry is not a medical profession, it's a tool of oppression, that's actually from people protesting the American Psychiatric Association, what we would call the rise of the anti-psychiatry movement. So some of the modern treatments, and again, the video that I was going to show you was going to show some of these: hydrotherapy or ice baths, insulin, coma or shock treatment, where they would literally give a person an overdose of insulin, stick a long rubber tube down their nose, and then give them a ton of sugar to bring them out of the coma, shocking the brain. Metrazole, which was a drug that induced convulsions. Prefrontal lobotomy, fever therapy. I learned something new. There was actually a treatment for the fever therapy or malaria. In order to induce a fever, they would infect people with malaria. We'll talk about some medications, including the very first antipsychotic that was the revolution, and then electroconvulsive therapy. So let's talk about the prefrontal lobotomy. This is a picture of Dr. Walter Freeman. And basically, there's a movie out there about Freeman called The Lobotomist. He was probably the most well-known lobotomist out there. He actually was still doing lobotomies in the 1970s. He actually did one to a well-known actress named Frances Farmer, and we'll talk about who else he lobotomized in a moment. So here's how a little history about how the lobotomy came to be. So Portuguese neurosurgeon starts conducting, experiments on animals, and then attends the same conference with Walter Freeman. Then Moniz, and actually started with rats, started dampening basically some of the neurons in the brains of rats, and found out that this calmed the rats down. 1935, he injects alcohol into the white matter of the frontal lobe of a female asylum patient in Lisbon. In 1936, Walter Freeman conducts his first lobotomy, but he doesn't do it with chemicals. It's a surgical procedure where they bore a couple of holes into the skull, and they literally sever the connections in the limbic system so that people are easier to manage. It makes people very placid. To bypass that, he decides to, because you have to go through the orbital bone right here, which is one of the thickest bones in the body. And so what he does is he starts using an ice pick to go through and to sever those connections. Unfortunately, in 1949, Egas Muniz won the Nobel Prize for the invention of psychosurgery. And when he won the Nobel Prize, that made it look like it was a legitimate treatment, even though people were, dying of infection and hemorrhage, and they really didn't have a personality. They had no emotion. The frontal lobe is where our emotion sits. So people indeed became very much easier to manage. Some people have continued to try to get the Nobel Prize people to take that away from this psychosurgery. So Rosemary Kennedy, she was the recipient of a failed lobotomy in 1941 by Dr. Freeman that made it difficult for her to speak, difficult for her to walk. It damaged her significantly. It was done because she had both developmental and intellectual disabilities, and Joseph P. Kennedy was embarrassed. He was worried that she would get pregnant, do something to embarrass the family. And so he actually had the lobotomy done to Rosemary without the knowledge of his wife. She actually spent the rest of her life, 60 years, at a Catholic institution where she was cared for by nuns. And she is really the reason why we have community mental health. And we'll talk about that. So that's a picture of Rosemary Kennedy pre-lobotomy. So ECT, electroconvulsive therapy or electroshock treatment, created in the 30s for schizophrenia. I already talked about the fact that it was administered without any anesthesia. It often caused injury to patients. Sometimes patients would convulse so hard that they would break bones. One of the negative side effects of ECT is it can cause severe short-term memory loss, and its effects are not always long-lasting. In other words, for people with severe psychosis, severe depression, or mania, especially severe depression, it can be the only thing that helps. So it's not entirely negative. Of course, we do it differently now. There's what's called bilateral, where they put the electrodes on both sides of the head, or there's unilateral ECT, and it's usually done for around every other day of, treatments for anywhere from 10 to 12 treatments. So here's some famous people that had ECT. So just some basic facts about lobotomy. 10,000 mental patients in the United States received lobotomy in 1950 and 51, which was nearly as many as had been operated on during the 1940s. ECT was a mainstay in the state hospitals. and approximately 4,000 mentally ill patients were sterilized in the 50s, which was the same number in the 20s. And this is all from Robert Whitaker's Mad in America, Bad Science, Bad Medicine, and the Enduring Mistreatment of the Mentally Ill. So now we're going to talk about Thorazine. Thorazine, or chlorpromazine, which is the chemical name, was actually developed in 1952 by the French, and it came to the United States in 1954. And this was actually the medication or the drug that allowed us to start closing state hospitals. So according to Robert Whitaker, chlorpromazine belonged to a class of drug or compounds called phenothiazines, developed in the late 1800s for use as synthetic dyes. And in the 30s, they were used as compounds as an insecticide and to kill swine parasites. When it was developed, what they did notice was that it had a way of calming down the brain, and people were able to get some remission from primarily psychosis. It was really, because of Thorazine, that was one of the main drivers behind the signage of the Mental Retardation Facilities and Community Mental Health Centers Construction Act of 1963, and the community mental health system was born. So this is a picture of Kennedy signing the Community Mental Health Centers Construction Act into law. One thing to mention was that JFK did not know his sister had been lobotomized until he became president. And she is the main reason why he wanted to do this, because he knew his sister had been harmed, and he wanted to make sure that she and other people like her were actually able to receive appropriate treatment. So what I do want to play is some of the remarks, and these are audio remarks, so you should be able to hear it. So Kristen, let me know if people can't. So I want to play some audio remarks.
Of S1576, Mental Retardation Facilities and Community Mental Health Center Construction Act of 1963, from the Cabinet Room of the White House, October 31st, 1963.
I'm delighted to approve this bill. It will make possible a major attack on the problems of mental retardation and mental health. Last week, I approved the bill to extend the programs of maternal and child health to enable us to overcome a major cause of retardation, lack of adequate care before birth and during infancy. This bill will expand our knowledge, provide research facilities to determine the cause of retardation, establish university-related diagnostic treatment clinics, and permit the construction of community centers for the care of the retarded. For the first time, parents and children will have available comprehensive facilities to diagnose and either cure or treat mental retardation. For the first time, there will be research centers capable of putting together teams of experts working in many different fields. For the first time, state and federal governments and voluntary organizations will be able to coordinate their manpower and facilities in a single effort to cure and treat this condition. Today, we cannot even identify the cause of retardation in 75% of the cases. Under this legislation, research in the life sciences will be encouraged, and in a few years, we can look confidently forward to knowing enough about mental retardation to prevent it in most cases. I am informed that the National Institute of Child Health and Human Development has already taken preliminary steps to implement the program. Dr. Aldridge, director of the Institute, will shortly call together some 50 distinguished scientists from the United States and other nations to plan the direction which research relating to premature births should take. Premature births has been identified as a factor closely connected with many cases of mental retardation. But no one yet knows what factors induce labor. With the help of the best minds of the world and under the authority of this legislation, we are optimistic about the possibility of finding out the causes of premature birth. Other parts of the bill are equally significant. Under this legislation, custodial mental institutions will be replaced by therapeutic centers. It should be possible within a decade or two to reduce the number of patients in mental institutions by 50% or more. The new law provides the tools with which we can accomplish this objective.
I wanted you to hear that because those, of course, were Kennedy's remarks when he was signing what we know as the Community Mental Health Construction Centers Construction Act of 1963. And so that was when we had sort of, the beginnings of what you would call the deinstitutionalization movement in our country. The problem was that at the federal level, the law was never funded appropriately, and it really wasn't until the late 60s, early 70s, when states really started to get the funding, that we really saw community mental health or community-based care really became more readily available. There have been, I want to make sure that I say that there obviously have been positive developments in psychiatric treatment. We have newer medications with less debilitating side effects. Chlorpromazine, Prolixin, Haldol, the older antipsychotics, what we call the typical antipsychotics. Some of those are still around, Melloril's not, but I know Prolixin is still used. Of course, one of the negative side effects of those drugs is that they created what we call the extrapyramidal side effects, things like what we call akathisia, tardive dyskinesia, basically people developing Parkinson's type, symptoms. As we move forward into the 90s, which the 90s were really the decade of the brain, we saw the development of what we now call atypical antipsychotics, drugs like Zyprexa and Seroquel and Risperdal antipsychotics. Of course, those drugs have a lot of side effects. Now moving into the 21st century, we have newer medications like Invega, we have Abilify and other drugs that seem to have less side effects. We found out that Zyprexa primarily, and of course Seroquel, some of these drugs were causing type 2 diabetes and contributing to other health-related issues. And the other thing that needs to be mentioned is that even though it's 2022, the way that these drugs actually work is still being understood. Basically, in short, psychiatry, and this is obviously a very, very abbreviated Reader's Digest version of mental health treatment and public policy. Just some real quick comments about current day. One of the problems we have is, Michigan was very aggressive and assertive about closing down state hospitals. Unfortunately, the jails and the prisons are now the new state hospitals where people are ending up. Of course, that's something that needs to be remedied. But we do try to continue to move forward. I think that one of the issues, and this is something that's important to MHAM, that we want to keep looking at two issues. One is reduction in stigma. Regardless of the fact that it is 2022, individuals with mental health conditions, particularly when they have a more significant mental health condition, or if they have a particular label like schizophrenia or schizoaffective disorder, or if they have psychosis or the more severe virulent form of bipolar disorder, bipolar 1, those labels in and of themselves are very, very continue to be stigmatizing. And yet there's a lot of individuals that have those conditions that lead very, very productive lives. And we also know today that recovery is possible. I've seen it myself and know that it is always a possibility. Want to thank you for coming, and just kind of want to take the last few minutes to see if people have any questions or comments about anything relating to this topic. And if you do, you can raise your hand and we can have a little bit of a dialogue.
There were a few comments in the chat box. One, Hannah recommended a book on the history of syphilis. and Mental Illness, How the Brain Lost Its Mind by Alan Roper. And Carly had mentioned, I'm surprised that even in the mid-1800s, it sounds like there was knowledge that recovery is possible from mental health conditions. Strange how stigma and misinformation exists to this day about how people can recover when it was known almost 200 years ago.
Yeah. Yeah, it's interesting that going back to Philippe Pinel, who created moral treatment, the idea that if we would just give people respite and a break from life, but treat them well, a lot of people would recover. And I think that that is largely true. Unfortunately, what became a really good idea, of course, became perverted. And of course, it was about money. Conditions got really bad in some states in the 60s. I'm thinking about the state of New York when they had significant funding cuts. And I don't know if many of you have heard the story of the Willowbrook School on Staten Island, but that was for individuals with developmental and intellectual disabilities. The conditions were very bad there. And Robert Kennedy was supposed to visit Willowbrook in 1968, but of course he was assassinated. So in 1972, a reporter named Geraldo Rivera took a key that he got from a psychiatrist and a social worker that worked at Willowbrook, went into Willowbrook with a camera and recorded the conditions there, and they were horrible. Literally, you had people with severe disabilities where you had one staff caring for 50 individuals. And when Congress, when that footage was aired, Congress was so outraged that what came from it is what we now have in our country called the Protection and Advocacy System, Disability Rights Michigan. We started with the PAD Act, which was Protection and Advocacy for Individuals with Developmental Disabilities. And then in 86 came the Companion Act, PAMI, Protection and Advocacy for Individuals with Mental Illness.
Dr. Bailey mentioned, she just really appreciates this presentation, and recovery should be and is the goal.
Yes, absolutely.
I just had one comment. This is Stephanie from the Michigan State Housing Development Authority, and I'm a person with lived experience with a mental health disability, and I've worked directly with people engaged in the community mental health system, living in adult foster care homes in Michigan at one point. And I had the just wonderful opportunity to interview some of the people living in those group homes that survived the forced institutions, especially when they were children up to their early adult age before they were, gained their freedom. And these were our senior older adult population living in our group homes at the time. And, based on those interviews, it just was so clear that they weren't even thought of as human, right? They were force-fed with feeding tubes. They were physically manhandled every day like cattle, right? Moving through the daily routines of getting out of bed in the morning to showering to eating. Just horrific stories. And, as much as we can talk about the history, it really isn't that far back, right? Mm-hmm. And I mean, there's still people that can share their story about being a part of that time period in the institutions.
Yes.
And I think we really have to be mindful that as we move forward with the way things are scapegoat right now for random acts of violence, and then there's always that narrative that follows that it's really not about gun control, it's about controlling people that are mentally ill, right? I mean, that is happening quite a bit. And there's some connection there, but it's like when you really look at the data, it really isn't about that. And mentally ill people are being scapegoated so that we don't deal with gun control. And then how will that impact rights moving forward, right? I really worry about that.
Thank you, Stephanie. I think that's a legitimate concern, because you're right. I mean, whenever there's a crime committed, I often cringe because the next thing I usually hear, oh, and the person had paranoid schizophrenia or something like that. And as you're right, if you look at the data, people with mental illness are not the ones committing these crimes. We hear about it from the media, but from a statistical perspective, that's not who's doing these things. So I appreciate you bringing that up. I do want to say this. I worked for Disability Rights Michigan, or the Protection and Advocacy, and one of the things that they do, and I did, was we monitor the conditions in the state psychiatric hospitals. And even though it is 2022 and I haven't been there in many years, I was there in the early 2000s, even in that job, there were still things that I saw that went on in the state hospitals that were very much reminiscent of what happened in the 40s and the 50s and the 60s. So you're right, it's not that long ago. And we always have to be mindful of the civil rights of individuals and their right to self-determination and their right to live in the least restrictive setting in the community and to not be unnecessarily institutionalized. The difficulty is right now we have individuals who aren't able to live successfully in the community, but they deserve to have the right treatment and supports. And if that means being in a hospital, then being in a hospital where they get the treatment they need so that they don't have to be there for a large portion of their lives. I want to thank you for joining us today. I hope that all of you have a wonderful holiday season. And again, really appreciate you joining us this afternoon for this presentation. I hope that you found it informative and helpful. So thank you so much.